So my name is Happiness Jeremiah Mshana. I am a lab scientist by professional with a background in microbiology and molecular biology and biotechnology. I have been involved in several projects that includes the public health, and this includes the malaria and neglected tropical diseases surveillance project to help informing national control programs of these two diseases. I'm currently working as a project coordinator in supporting National Action Plan on Antimicrobial Resistance in Tanzania, the project that aims at assessing and addressing social, cultural, and biological drivers of antimicrobial resistance in Tanzania. Antimicrobial resistance is a condition whereby microorganisms such as fungi, bacteria, viruses, and parasites changes over time and no longer responds to the medicine and making it harder treating some of the common infections, a situation that increases the risk of prolonged illness, disability, and eventually death. I think it's very important that we address antimicrobial resistance in Tanzania Tanzania public health system, because antimicrobial resistance is a global concern now with new emerging resistance mechanism of some of the microorganisms that threaten the ability of so many antimicrobials to treating common infections such as urinary tract infections, sepsis, diarrhea, and other common infections. So in my opinion, I think it's very important to have education campaigns that target antimicrobial resistance, that target the public, because antimicrobial resistance affects everyone in the community. Antimicrobial resistance is a concern because it does not select which people to affect and which ones not to affect. So educational campaigns are quite very important, especially in the public, to make sure that people are being educated about antimicrobial resistance, but also in helping out raising awareness by having quite a number of campaigns that will be able to raise awareness to the public, such as infection prevention control measures, such as washing hands, that will help removing some of the microorganisms, especially those that are resisting some of the antimicrobials, and that will help in protecting the public against antimicrobial resistance. One of the objectives of our project, supporting National Action Plan on Antimicrobial Resistance, was to raise awareness to the both hospital settings and community settings. So in community settings, we choose to use daladala and bajajis to raise awareness to the community members who are coming to the hospital and those who are getting out of the hospital to town. So we have setting up a few daladalas and bajajis, and in these daladalas and bajajis we have them stickers that have different messages that addressing different themes of antimicrobial resistance. And these messages are divided into three parts. Our messages on the stickers that were provided to the daladala and bajajis were divided into three components. We had messages that were general messages about antimicrobial resistance, but we had specific messages on antimicrobial resistance, and then we had action messages that addresses how can community members, or how can someone do, or what can be done in order to reduce antimicrobial resistance. So these messages involves like washing hands and other messages that are relating to that. So one of the examples of the general messages that we have in the stickers on both daladala and bajaji campaigns read as follows: we all have a role to play in fighting against antimicrobial resistance. So another example of an action messages that we had was wash your hands regularly. This is one of the messages that we believe it will help people in understanding the infection and prevention control measures of infectious diseases.